I did get a law firm to volunteer their services to making it a 501c3, which we have, and that's why we're moving on to our master proposal.
Right.
What was your name?
John.
John.
Thank you.
John, thank
So
you.
if I get a live one, can I like pass them off to you? So I mean, I've got some places where I might be able to go, where I can find some interest, but I'm not at the point that I can handle it yet myself because I'm not licensed.
You mean where people, you can have volunteers who are working? Sure, I'd be happy to talk with you
Okay.
about it to see if there's something we can do with that, depending on where you live. So, yeah, thank you. We're trying to expand our network of people who are interested, and I guess I appreciate this opportunity of being able to share with you. Excuse me.
Yeah, my name is Sam. And,
What did your
you
name
do
again?
Sam.
Sam?
Okay. So do you do only the ear acupuncture only there?
Do we now only use ear acupuncture? Good question. And it certainly was the subject of a lot of discussion when we first started. When our first idea was to just do the ear, because it's very effective and in a lot of ways, and it also keeps it in terms of time. We do moving fast. There were times during the week where I had by myself in a 2-hour time 25 people, and it was very stressful. But what happened is that when we started, of course, we were hoping that when we first started we were going to get a ton of people. But which I think is pretty common, when we first started, we didn't get a ton of people. So people would come in and there'd be 1 or 2 or even 5 people, and they had shoulder problems, So I was like, oh gosh, I've got all this time. What the heck? I'm gonna put a needle in their shoulder, or obviously they needed spoon sticks, or whatever. So we do now do some body points, and when it gets really, really busy, it becomes more complicated. But what we've tried to do, and we've spent a lot of time, we try to meet on a regular basis, and think these things through. But we try to keep the number of body points to 2 double-sided, and it's actually a good exercise of refining our diagnosis and practice to only have those 2 needles, So I don't think it's a bad thing. We do have one clinic where we just have done the ear, and for a number of reasons we just started adding a couple of points again to that. So, but I think it can be, depending on how things start. If it's a large group right from the start, I would encourage people, or even a moderate size group, to try to keep it to just the ears, particularly if they have other places to get body treatment. If they don't, then, and there aren't many places. Now people can go to schools like the University of East West, people can go to the clinic, and so it's less expensive and stuff. But there really are people who don't have any money. I know we don't generally have the feeling that that's true, but people who just come out of prison, people who are in recovery and lost everything, so sorry, I didn't mean to go on and on. Long-winded answer to your question. Does that answer your question? Yes,
Are you still doing the NADA points on everyone?
Yes.
As one.
Unless, of course, as you all know, we take it very slowly. We take it 1 point at a time. And there are some people who just keep, particularly the women in the recovery house, there are women who will just get 1 shim in.
Wow.
And that helps them a lot. And that's hard for them.
Wow.
Because they're so, and understandable. The women in the recovery houses have been through all kinds of abuse, and so they're traumatized. Quite traumatized.
Do you find that the people who've had addiction with needle injected medicines are more resistant to needle therapeutics?
I would say there are 2 extremes. There's a group of them who do not want to be anywhere near needles. And then there's a group of them who say, I put my body through everything, I can certainly have needles in my ear. So it really depends on the person, I would say.
Okay.
But I also would say that there's within the African American community, there is a lot of suspicion about healthcare in general, and which with good reason, because of the kind of experimentation that has gone on. So there is a certain, and I mean, I don't mean to speak for the African American community, but I experience that what I hear from people is that there's a lot of caution about anything that smacks of something different. Certainly not for a lot of other folks, but there's a certain group of folks who feel that way. And then there's, of course, others who are very open and whatever. Within the Latino community, there are lots of folks who are very open to herbs because of the experience in their own countries, and cupping is because they do cupping, like in Mexico and whatever, as I'm sure you know. The acupuncture, on the whole, people have been willing to try pretty across the board. So, yeah, good.
How do you set up the clinic? Do you have a table, or you just let the patient sit on the chair and then do the acupuncture?
Well, I make do with what I have at the organization, you know, but generally I do have a table where I set out the clean field and whatever. I do have files for everybody, and we take them with us every time, and we do the HIPAA stuff, and I try to, we definitely have our system pretty well worked out. There are some of your clinics that actually don't keep files on people, but we definitely do. And we make sure they get their notice of privacy and the whole thing. So in terms of setting it out, yes, we have, it's of course not like an office, but we do the best we can. We try to wash our hands where we can. Some places don't have a place to wash, so we use our, you know, the squirter thing, and alcohol and stuff. Try to wash our hands when we can. That's a question. John?
That was a question.
Oh, okay. What was your name?
My name is Ken.
Ken. Okay, thank you.
How many volunteers do you have right now? How many people are working with you?
Well, it's hard to say. The most active ones are probably that come regularly are like maybe 7.
Great.
But then there's a whole extended growing group of people who come when they can, who are supportive in other ways. Yeah. So,
Great.
having a meeting in a couple of months. And, I think there'll probably be maybe 15 people in the meeting.
Excellent.
So, well, thank you so much for the opportunity for me to talk with you, and I appreciate so much your hard work at getting through. I know that it takes a lot to get through this personally. I know that it takes a lot, and we doubt ourselves at different times, and it's also scary to think about going out and making it work for ourselves, because it isn't easy, as you know. But our passion helps us, doesn't it? And I'm sure that you all, if your heart is in it, as I'm sure it is, that you will all do very well. And if there's ever any way that I can help any of you, I certainly would love to do that. So please